third dose of the coronavirus vaccine, now recommended by the CDC, is based on the research that our immunity from the shot drops over time. But as medical reporter Liz Bonus explains, without a control group to compare that doesn't get a third shot, it may be tough to answer some critical questions.
Hey there, hello to you. One of the top questions right now is that even though it was the Delta variant that contributed to the CDC suggesting a third dose for all Americans, people aren't sure right now if that additional shot will really work against it in time to impact this sort of fourth wave.
So what we know so far from the data that is coming out is the Delta variant is more transmissible and it can cause more severe disease.
So first question we don't know the answer to yet is, will a third shot that boosts antibodies boost severe disease protection?
Vaccinations are really geared towards preventing an illness, not towards being a shield to completely prevent infection. So just like the polio vaccine, which didn't stop people from getting polio infection, but what it prevented was from them getting paralyzed from polio. Similarly, the COVID vaccines don't prevent people from getting infected, but what they do is prevent them from getting very sick, having to go to the hospital, getting in the intensive care unit.
Second question, will a third dose stop the virus from spreading more to others, even from vaccinated people who get infected, especially children?
We already know that people who are vaccinated tend to transmit it to fewer people than people who are unvaccinated. But I think that the data is limited on whether that's going to make a big difference or not.
Finally, since we already know that with the two-shot dose,
if you are fully vaccinated, you still have a high degree of protection from the worst outcomes of COVID-19, severe disease, hospitalization, and death.
Will a third shot reduce this current wave more quickly than if we don't give a third shot?
In every upslope, there's a hyperventilating about as though that this spike is going to go into infinity, and they never do. They always crest and go back down, and we usually trail behind Britain by several weeks, and it appears that Britain, which had the spike before us, appears to be cresting and going down. So in all likelihood, we're probably 2 to 4 weeks from hitting the crest and hopefully going down in many parts of the country.
Now, many say with nearly half of Americans still needing the first dose, it is important that each additional dose does have the research so that those hesitant will have confidence in the science behind these decisions. I'm medical reporter Liz Bonus. Now back to you.